It is right now unethical for doctors not to use AI. Even now, AI is better than medical doctors. Eventually, robots will be better than most surgeons. We have to cure the mother of all diseases, which is aging. It will depend on how fast we can evolve AI and develop these digital twins, because the real bottleneck is the clinical trials.
Few scientists have pushed medicine further than Dr. Derya Unutmaz. A world-class immunologist at the Jackson Laboratory, he stands on the front line of the emerging medical singularity, using AI to fuse biology, immunity, and aging into a new blueprint for human longevity.
Imagine having virtual cells, virtual tissues, and in fact digital twins where AI can make predictions based on running experiments, literally digitally.
Are we already at longevity escape velocity, that mythical date where we can make ourselves live for one additional day for every day that happens on the calendar?
I don't think we are there yet, but I'm very confident we'll get there in years.
You're listening to The Human Upgrade with Dave Asprey.
You've seen incredible change over your career in our technology capabilities. And what's the most promising way that AI is going to extend our lifespan?
There are several, but I think for me the most important thing is that AI will be able to simulate biological systems. What I mean by that is, and we can go deeper into that, imagine having virtual cells, virtual tissues, and in fact, digital twins where AI can make predictions based on running experiments, literally digitally. I think that's really transformative because something that takes years, like clinical trials or, developing new drugs, can literally take minutes or hours. So I think that will change everything.
Are we going to have to redesign our approval frameworks in order to take advantage of this? Or is everyone just going to go to Abu Dhabi and Costa Rica where they don't bother with stopping you from doing things?
Takes a while for people to accept that even now AI is better than medical doctors. Eventually robots will be better than most surgeons. And so, the society will demand that, and if AI can run clinical trials better, faster, and most importantly, in a personalized manner. I think this is the biggest problem in medicine. In fact, 2,000 years ago, Hippocrates said, you need to treat the patient, not the disease. But in medical school, they teach you to treat diseases. So if you can personalize, if you have your digital twin and AI can run drugs for you, and if it's going to save millions, eventually billions of lives, I don't think regulations can stand in front of that.
Thanks for saying that. And it is highly personalized. And I look at when I started doing longevity stuff 25 years ago, just for myself, it was very much, this is what everybody does. And over time, you realize, well, it doesn't work for me, even though it worked for the guy next to me. And it feels like even now where AI is, mine's very well trained, but it's not a medical AI. Man, the wisdom that comes out of that, even with the kind of knowledge that I have, I'm like, wow, I hadn't thought of that pathway. It's so profound that the personalization's happening. And what I'm a little bit concerned about is most lay people don't know what questions to ask around longevity when they're working with an AI system. And not a lot of physicians we can go to are using AI at this level yet. Maybe they are themselves, but they're not interacting with patients that way. How do you talk to AI? Do you use GPT or Grok or something? Or do you have some sort of special university trained on PubMed kind of thing?
No, I use ChatGPT, and actually was probably one of the first users since ChatGPT 3. I also, test new models. I'm testing one from OpenAI. I can't really talk about it, but it's and they are just unbelievably good. I mean, I can tell you, my mom who asked me medical questions because if she gets sick, says, "Well, what should I do?" Now I tell her, don't ask me, ask ChatGPT, because ChatGPT knows better than I do, even in cases where, I'm an expert. You can't really compete with AI on these things. But the real power, I think, going back to your original question, because this is really, really important, the real power comes from personalization again. Something like ChatGPT has a memory now. It knows about you. The more data you feed it, it will sort of personalize suggestions to your age, your conditions, and so on. And not to mention, if you feed it with data, for example, lab data is very, very important. People have this notion, including many doctors, that if your glucose or cholesterol or whatever is within a certain range, it's normal. If it's a little bit higher, it's not normal. But again, it depends on your set points. Cholesterol a little bit high for you could be normal, actually. Or cholesterol that is within the normal range could be abnormal for someone. Statistically, I think 70% of people who get heart attacks due to atherosclerosis have normal cholesterol levels. Or only 1 out of 10 or 1 out of 20 people who take statin actually benefit from it, because we don't really know whom to give. Obviously, we give to everyone who has high cholesterol. Some do benefit, obviously, but many don't. And so I think, to know your set points, your ranges, if you upload these data, every 6 months or every year, whatever, the AI will learn and say, okay, well, you are now outside of your normal, and will give you advice based on that. And they're just getting so incredibly powerful. I think you can just use ChatGPT or Gemini 2.5, Grok. They're all great. And the next models are going to be even better.
Wow. So you're as excited as I am. Are we already at longevity escape velocity, that mythical date where we can make ourselves live for one additional day for every day that happens on the calendar?
I don't think we are there yet, but I'm very confident we'll get there in 10 years, maximum 15 years. That's the point where we have to be, I think like GLP-1 agonist probably is beginning to cross that. There's some calculations that if everybody used GLP-1 agonist, I think the average lifespan would increase by about between 5 to 10 years. Like you go from, average 80 years old to 90, so one drug can make a huge difference. It will depend on how many of these type of drugs that we'll have in the next decade. Especially, the muscle drugs are going to be really important because this is a huge problem during aging. But I think we're very close. In fact, I tell people, try to stay alive for the next 10 years. Then you're good.
Okay.
We're definitely getting. I mean, there's. I would be very surprised if it's longer than that. And in fact, it will probably happen very quickly. We'll see that in the next 5-10 years there will be some advances. Maybe a couple of more drugs that will add a few more years. But suddenly, we'll see a massive jump. Average lifespan 90 to, in 1 year, we'll jump to 95. Next year, we'll jump to 100. And especially once we start to reverse the aging process, then, we already escaped the longevity, escape velocity. It'll probably be only a few years. And then after that, it will be, into the space. So we're really getting there. And I think it will, again, depend on how fast we can evolve AI and develop these digital twins, because the real bottleneck is the clinical trials. If you're testing for something that will reverse aging, it's going to take years and years, right? So we have to be able to do that and iterate on it very, very quickly. So once we get there, and we just need the data, we need a tremendous amount of data. We need a lot of compute. A lot of electricity. So that's why I think, investing on data centers and energy should be top priority. Once we have that, then in matter of months or sometimes weeks, we'll discover hundreds of new molecules, and we're approaching there. It's very exciting.
So about 5 years is maybe you're aggressive, and 10 years is you're conservative.
Yeah, the reason I'm saying 10 years, the AI will be capable within 5 years. There's no question about that. I think we'll get to ASI, artificial superintelligence, in 3-4 years. The problem is that sort of the diffusion in the society, it has a lag period. We see this in medicine right now, right? So in my opinion, right now, AI is better than almost all doctors, including specialists.
Wow, I think you're right.
but it's going to take probably another 5 years before, people can say, well, okay, AI will be my doctor, right? They will completely trust for that. And I think that's the same thing will happen. When can we trust AI to run clinical trials, or that it will make decisions that this drug will work on these type of people? Even though it's going to be capable in the next 3-5 years, it probably will take another 5 years before all the regulations, all the stuff that society has to accept. So I think that's the limiting factor.
Do you think that AI doctors should be allowed to write prescriptions?
Absolutely.
Wow, I do too.
I wouldn't even blink on it. I mean, because I test this all the time, and actually we're developing some benchmarks for various specialties, dermatology, and so on. The imaging part still needs a little bit more advanced, but it's actually almost getting there as well. But otherwise, something like O3 model from ChatGPT or O3 Pro is. I cannot imagine any highly specialized oncologist or whatever can compete with that, because it thinks of every single, and it actually has an access to internet, so it will pull up all of the information. If there was a paper that's published yesterday, you will actually incorporate that. And this is really an important issue. In fact, I said in Twitter several times that it is right now unethical for doctors not to use AI. Very soon it's going to be malpractice.
Yeah,
because there are 12 million misdiagnoses in the U.S. alone. About 700,000 people die or severely harmed because of mistreatment, misdiagnosis. I mean, this is massive. So AI can reduce that to literally nothing, because it will not make those mistakes. It's sort of like self-driving cars. If every car was self-driving, we would have almost zero accidents. We'll save about 40,000 people. But in healthcare, we can save hundreds of thousands of people. Not to mention, we can lower the cost of healthcare by 10x at least, because the AI will also predict what type of disease you will have, or whether a patient should be triaged, whether it should be in hospital for 5 days or 1 day, or not in hospital at all. Most of this is, doctors just do it. Oh, well, let's be safe. Let's keep the patient, 3 more days. They don't really know if it's necessary or not. But one of the cool things about biology, even though it's extraordinarily complex, at the same time it's very, very predictive. People get surprised about that. There's billions of reactions happening in your body and trillions of cells, but you can start from a single cell and you can recreate the same human being. Like in identical twins, right? Everything can start from a single cell where there's trillions of things that happen and somehow nothing goes wrong. you know, or you can just give an aspirin out of thousands of metabolic interactions that one molecule can actually heal you or fix you. So in a way, biology is highly predictable. We just need to see that, and we can't see that because there's billions of reactions that our brain cannot process. AI can do that. And so the impact of AI in medicine is going to be unbelievable. But unfortunately, there's a lot of resistance, including from some of our colleagues.
Are you worried that AI systems are trained on bad data? I mean, PubMed can't be reproduced for the most part.
This is a very important issue. In fact, I mentioned about digital twins, digital virtual cells a number of times. I think one of the things that I'm worried about is that we don't have high quality data to train AI to understand fully the biological system or simulate the biological system, because even sort of data in the databases, like for example, proteins and RNA-seq data and this and that, or even microbiome data. Not all of it is high quality, and so we definitely need to have better quality data sets, and I think some companies should definitely focus on that. But at the same time, I'm hopeful that AI can discriminate between the bad and the good data. And again, there's a model that I'm testing right now, which is an agentic model. So the very cool thing about AI agents is that they don't take things for granted. So if you ask ChatGPT, it will go and find information, and it will distill it and give it to you. But agents are not like that. So you can have an agent that will find some information. The second agent will criticize it. Well, it will say, "Well, how do you know that's true?" And the first agent said, "Well, we made him. Your point is well taken. Let's go and find more data and more truth." And so by interacting with each other, they can really sort of find what's closer to the truth. There's never absolute truth out there, but I think, in fact, one of the things that I love about using AI is to criticize papers, including my own. So I uploaded some of my papers that I thought were great. They were published, they were reviewed by reviewers. But AI found issues that I had missed, and I was like, "Oh, oops!" Fortunately, it said that everything looks good. But if you had done this experiment, it would have been better supportive and things like that. So I think eventually AI should be the reviewer of all papers.
Wow! Instead of peer review, imagine what that would do.
Yeah, absolutely. I trust AI much more than human reviewers.
Let's talk about teaching. You say a lot online about how AI is going to change the world of teaching. I ran a program for the University of California on web and internet engineering for 5 years. I spent a lot of time teaching working professionals, and it's really hard work. And even if you're a great teacher, it seems like half the class is behind and half the class is a little bit bored. How is AI going to change that?
Completely. I think the current education system has to be totally scraped. And I say that as a professor. I've taught medical students and PhDs. But as you said, you have to personalize education. And also, learning is different than teaching. Like you can teach, but people will not learn everything you teach. So in order for our brains to keep something or learn something, it has to be two things. Either has to be a threat, because the brains are evolved to look for threats. If it's something dangerous, threatening, you will remember that, you will learn that. Or it has to be fun. It has to be like a game. In fact, children learn everything through games, right? So playing. In a way, games are simulations of what might happen. It's also predicting the future threats. Like I play a lot of video games. I'm a big fan of some shooting games, and some parents don't like them, but actually those are kind of simulations of how if there was a threat, how we would react to it. But you feel fun. That's how you learn. And I think AI can do that. It will sort of teach you the way you can learn and make it fun. And actually, I personally learned so much from AI. I mean, in the last 2 years, I probably learned more about topics that I'm interested, but it's too boring to go and read some textbooks or online, whatever. I say, like, I don't know anything about this to ChatGPT. Explain it to me like you would explain it to a kid, or, about quantum mechanics, it's really incredible. It really makes things very easy to understand, and through analogies, to metaphors. So I think it's no brainer that, at least the higher education should be completely replaced with AI. Lower education, I think teachers still have a role, because there's that personal touch that's important. But after high school, I don't see a role for myself as a professor, actually.
Is it still worth it for an 18-year-old to spend $100,000 plus on a 4-year college degree when everything is available for free on AI?
Absolutely not. Absolutely not. I mean, it's probably the worst investment of money and time you can do by going to a college for 4 or 5 years. But actually, everything you learn is already obsolete in matter of months. Last year, about a year ago, I tweeted as a warning to medical students or people who want to go to medical school. I tried to discourage them, and there was a lot of pushback. I said, well, we need a lot of doctors and so on. Yeah, we need a lot of doctors, but by the time somebody goes to medical school and becomes a resident, it's about a decade of training. So it's a very, very long process. Imagine how things will be in a decade. We have robots which are going to do surgeries better than human surgeons. So there's really not. Going to medical school is extraordinarily energy tiring, and expense is unbelievable. You're not going to get back your investment. So I think my suggestion to young people is that at the same time, this is a tremendous opportunity, right? So instead of wasting $100,000, $200,000 in college or other schools, use that time to really learn how to use AI, and have agency and curiosity. I think those are two important features. You have agency, you have curiosity. There's literally nothing you cannot do.
I am very close to, for my 18-year-old daughter, just saying, look, do some deep learning with AI, and let's take the money that we were going to spend on college and let's buy a small company so you learn how to run it, because it's a better investment. At least you get a return on it. And I do not believe that anyone spending 4 years in college is going to get their money back right now. It's just not how the world works anymore.
Absolutely not. I mean, I think people are either coping or delusional or have no clue what's happening. Anything that can be done in computer will be gone in matter of years, if not sooner. In fact, even physical jobs are going to be very hard to compete with robots. That might last a little bit longer, maybe another 5-10 years. But at the same time, someone like your daughter, if she buys a company or starts a company, just by herself, she can run a company. You just hire AI agents. You can have an agent do your website. You can have an agent as your marketing personnel, and it's really remarkable how one person can do so many different things. And so I think we're going to see much more of that. People will really focus on personal. If you think about it, throughout human civilization, jobs are a recent invention. Right? We didn't have jobs until like 200 years ago.
It's totally true, and that advice is tough advice for people finishing high school, thinking about going to college. But I think it's real, and I applaud you for being willing to say that. It's controversial, and you're speaking as someone who's high up in the university education system. It's going to have to change rapidly. You've written more than 150 papers, and you know so much about immunity and what's going on in the systems biology space. But I want you to put on your hat and say, let's assume that AGI rewrites the rules of immunology. What foundational assumption would it throw away first?
We tend to think that, our biological systems are just marvelous. In a way they are, but they are highly legacy systems. So they're not sort of a perfect engineering. It builds on top of each other. Something that was important, 10,000 years ago or 1,000,000 years ago is not important anymore. And actually could be detrimental, but you can't just get rid of it. You just have to build on top of it and regulate it. So, if you look at it from a very engineering perspective, it's not a very good system. In fact, immune system probably kills more than saves. Most of our problems, chronic inflammation that causes heart disease, Alzheimer's, and autoimmune diseases, and not to mention, in many infections, that overreactions of the immune system kills more people. We saw that during pandemic. Most people died because their immune system just worked too much, too good. So it has to be very, very tightly regulated. And if you regulate it too tightly, then you don't get responses to cancer. So there, the problem is just the opposite. So I would say, to answer your question, I would sort of totally re-engineer the immune system. I would call it as immune system 2.0. And I think that will solve a lot of problems. And immune system is also involved in aging process. It actually accelerates aging. We first saw that in HIV infection. I used to study HIV immunopathogenesis, and what we notice is that as HIV infected people are living longer, their immune system was accelerated in aging, which in turn resulted in them getting heart diseases a decade earlier than they would normally, because the virus was infecting sort of the generals of the immune system, and it was really kind of causing it to be exhausted and so on and so forth. So there are many, many parts of the immune system that could be more simplified, re-engineered, that could regenerate better, that could regulate better.
I cannot wait. My immune system has been problematic. Was diagnosed in my early 20s with chronic fatigue syndrome and fibromyalgia. I've had toxic mold exposures, and I've been managing immunity and stress hormones manually ever since. And I'm abundantly healthy, but it's through a lot of careful balance. Is chronic fatigue syndrome and long COVID, are they really just mast cells misbehaving?
I think there are a number of different things. The mast cells probably are involved. We think, I'm a T-cell biologist, so a little bit biased. T-cells are probably at the center of the things because, T-cells sort of regulate or being regulated by the microbiome. The metabolites produced by these trillions of bacteria that live in your gut, which, by the way, really control a lot of our metabolism, our nervous system. Even depression could be caused by some bacteria that's living in your intestines, and they have a tremendous impact on the immune system. So obviously, many immune parts are sort of dysregulated, and mast cells being one of them. And one of the things about mast cells is that they produce huge numbers of cytokines, what we call these small molecules that actually control and regulate other cells. So this is a very networked interaction, and immune system is the most networked system in the body. There are dozens and dozens of different cell types. They all have to communicate, just like in an army. You have so many different levels of communication, and then you have to discriminate these trillions of bacteria from the real pathogens. Most of them are beneficial for you. So how do you keep that peace? And you have to make sure that they don't cross the border. And so when that is disrupted, the whole system starts to collapse, and everything. And eventually, that leads to a lot of the symptoms.
So you're an immunologist. What is the single immune biomarker most underrated for longevity?
Your question, again, is a great one. We don't exactly know the answer, but we know some things. Again, in the immune system, you have certain type of cells that we call exhausted, but in reality, they're not really exhausted. These are, I like them to liken to mercenaries. They're battle-hardened cells that fight war after war. For example, you have these cells that are specific to CMV, which is a type of herpes virus that you can't get rid of out of your body, but you need your immune system to constantly fight it or suppress it. If you have immunodeficient, the CMV will come out and will kill you. And eventually, in some elderly people, almost a third of your immune cells, like T cells, are dedicated just to keep that CMV under check. And what we observe is that these cells have this sort of the exhausted phenotype, but in reality, it shows that they have just fought a lot of wars, and they became very dangerous eventually. So they're being suppressed, but not sufficiently. And actually, because they're kind of like mercenaries, they will cause, with the slight of a trigger, they will release these cytokines that we call inflammatory cytokines. And that will damage, just normal tissue. And that will cause chronic inflammation. And then it will block your arteries and so on and so forth. So I would say that particular cell type, which we can define phenotypically, is probably the most problematic.
It makes sense to me. I also write longevity books. I'm not an immunologist at your level, but I've gone pretty deep on it. And we talk about zombie cells as the common thing for senescent cells. And I think a lot of listeners understand some cells that they're exhausted, they're not doing their job anymore. They're kind of floating around, taking up resources. So what do you do? You're an expert in the field. Do you take senescent drugs? Do you do intermittent fasting? What's your personal strategy for dealing with this?
I take some supplements, and in terms of drugs, I use Metformin, even though I'm not diabetic. But the energy metabolism is very, very critical. You really have to control it. I think diabetes and high sugar levels is one of the worst things you can do to your metabolism. It really disrupts pretty much everything, and it causes inflammation because it's kind of like a fuel. Mitochondria love it. When the cells are very, very active. But that results in lots of redox potential and because that's their job actually, and that damages the tissues and cells become more exhausted. There's an entropy happening there. So if you could control energy metabolism, in fact, drugs like rapamycin, that's what they do. So the insulin pathway, the mTOR pathway. So metformin, I use it because it's a very safe drug, and there's study after study that shows. In fact, I think mortality from all causes are reduced by about 10-15% for those who use metformin. In fact, diabetics who used metformin sort of lived longer than normal people, which was the first observation. Other than that, I take omega-3 fatty acids, sort of fish oil, which I think are important because you got to really balance your omega-6 versus omega-3. Then I also take, nicotinamide ribocyte, NR. I won't give the name of the company because I don't want advertisement. You probably know. NR is the precursor of NAD. And so what happens is that as you age, especially after age 50, 55, the NAD level starts to go down, and that you need to sort of replenish. Certain things you need to make sure that, you take them at certain ages. Taking NR age 30 is not going to really help you very much. I take urolithin A, which has been shown to have an impact on the immune system. What else? I take sort of some extracts like broccoli extracts because I hate broccoli. I don't eat it, but it's extremely useful for you. Garlic, for example. I like garlic, but I don't eat it very much. The other thing that I think, besides supplements, obviously your diet is extraordinarily important. And one of the most important things for me is, olive oil that has high phenolic acid components. Extra virgin. I use a Greek olive oil. I make sure that I take olive oil every day. I think
about 30 mils, or what's the amount?
Something like that. One spoonful. Either mix it with food, or you can just drink it. And I actually like to, but also really limit your carb intake. I think I wear a glucose monitor. Again, I'm not diabetic, but it's extremely useful because there are things that you don't notice that could really spike your glucose, and you want to make sure that it comes down very quickly. And it sort of provides a auto feedback. There are other things, but I think most things that and you talk about.
It's a great list. It's helpful to know, as an expert in the field, you're doing the same thing that a lot of us biohackers are doing. I have determined that baklava is actually a longevity substance. Is that true?
Without the sugar, yes. I'm from Turkey, so
I know. I was eating Turkish baklava in Dubai last week with reckless abandon. I might have blocked this as much as I could. What do you think about berberine versus using metformin?
I prefer metformin. I think there's definitely more data. Berberine has been, might be useful for diabetics. The other thing is I've started to take small doses of the GLP-1 receptor agonists. They're really miraculous drugs. I had a little bit of weight problem that it solved it. It was that, but regardless, I will probably continue taking that, small doses, rest of my life as long as I can, because it really has a sort of an anti-aging effect and really sort of normalizes the metabolism. And it's a natural hormone that your body makes, but some people don't make it enough, and so I think. That's very useful, and I'm looking forward to drugs that will increase your muscle. I think they're coming soon. I don't do too much strain exercise, which I should. That's also very, very helpful.
Right. There's only so much time and effort in a day that you can invest. Do you block your CD38 cells when you're increasing NAD?
That's an interesting question. So CD38 can be a good marker or a bad marker. So it's not necessarily bad in the sense that if your cells are like immune cells are activated, they will upregulate CD38 because they need to metabolize and intake NAD. I don't recall any study that shows that the receptor cell is blocked. Actually, I take it back because we did try in vitro experiments where we added NAD to T cells. I don't think we saw any difference in their expression of CD38 per se. But in some cases you may want to downregulate CD38 because the cells that I mentioned that are overly active, sort of the exhausted but actually overactive cells. In that case, that may not be a good thing.
Got it. Because we know that CD38 loves NAD. So if NAD levels go up a lot, CD38 goes up, which can be inflammatory. And some of these are kind of in the weeds for new listeners going, what is going on? But if you've listened to a few of the episodes, there's an episode on each of these compounds. There's actually 4 or 5 on urolithin A and on NAD. And what's really interesting here is we have someone who's spent his career in the field, 100+ papers, doing the things that are most likely to extend longevity. Even GLP-1s, a lot of people are judgy about those because, it's not fair to lose weight without suffering. But as longevity drugs at low doses, they're magical.
They're magical. For example, I used to have, apnea, totally solved that problem.
Wow. Just from GLP-1s.
Yes. Just from GLP-1. It has so many different functions. It's really remarkable. But I think your listeners should realize, biological systems are very finely tuned, and it can change from person to person. Some people really need GLP-1 agonists because their body's just not making enough of it. It's a hormone that our gut cells are making. And so you're literally reconstituting that, or that its amount is dropping as you age, for example, right? And so you need to reconstitute that. Doing too much of it may not be a good thing, right? So for any of these supplements, I mean, you can't say, well, I'm going to take 10 grams of NR, so it's all good. Well, there's a limit, as you just said. It could, everything is like a double-edged sword. It could work for your, and I think the other thing is that people should really analyze their metabolism. There's some companies now that looks at hundreds of different metabolites, different small molecules, lipids, and so on. That's extremely useful. Or if you have deficiency in vitamin B12, you should definitely take vitamin B12. Or if your vitamin D is very low, you definitely need to take vitamin D. But if it's, normal ranges, do you really need to take high doses of vitamin D? Probably not. So it's a very tightly fine-tuned system that there's no all good or all bad.
Thank you for sharing all of your longevity knowledge and just your perspective. You've developed incredible wisdom of going so deep on all the systems biology, and it's refreshing to hear how you think about it. So I appreciate you and appreciate you being on the show.
Thank you so much. This was a lot of fun and great pleasure. Thank you.
Guys, if you would like to know more about Derya's work, go to jax.org, where most of his research is, and, stay on the longevity bandwagon.
See you next time on the Human Upgrade Podcast.